Joining us on the line right now is Elkhart Mayor Rod Roberson. Mayor, how you doing today?
Hey, Casey. I am fine. How about you? Much better. How are you?
I'm doing good. So, I mean, obviously you and I believe your wife got COVID. I don't know if anybody else in your household did. And I mean, how was your ride? Are you guys okay? Was it a fairly mild case or more serious?
Well, it was a consistent case. I mean, the symptoms I had were mild, I would say, relative to some of the others who have been sticking with it. But it was very consistent. And what I mean by that is that fever, if I didn't take any Advil or Tylenol, and I had the aches and pains and lack of appetite. Didn't eat for about 7 or 8 days. Lost a little weight. I guess that was a good thing. For I wouldn't want it to be that way.
Right.
And literally, you feel as though there's a little fog around you. It was which made it very different than the flu.
Okay.
I think I think we got through though. It was a good thing, and finally got to a place where we were feeling a whole lot better.
Well, I'm glad both of you are okay.
I'm sorry?
I'm glad both of you are okay.
Thank you. I am as well, because there were others that haven't made it. And as a matter of fact, a friend of mine was going through it at the same time. We were texting each other, and he thought he had passed the most significant part of it. And he was asking me if I were okay. Glad I was. I said I'm glad he was. And 2 days later, he took a turn for the worse and didn't recover. And I went to his funeral Friday. So that was kind of a poignant moment for me relative to this.
Yeah, I'm sorry to hear that. Talk a little bit about what's happening with the local hospitals here. I know that Elkhart has been hit pretty hard. Hospital staff and I mean, Beacon Health has been telling people, even if you're exposed to COVID, still come in and work. Tell us a little bit what's going on in the hospital.
Well, they have and are still under quite a bit of strain. The available beds are zero, and relative to COVID, their healthcare workers and providers, for lack of a better word, nurses, docs are under what they have termed their psychological
PTSD?
relationship is just there we go. PTSD is just absolutely going is devastating inside of our hospitals, and it's kind of strange to think about our hospitals being that way, but it is. Vents are zero. It's a tough case going on right now, and it puts a strain on all the other elected procedures that come in through our hospitals, and so it definitely is putting us in a very tough place relative to our hospitals. And we've had a couple of meetings regarding it, which is one of the reasons why we're talking this ordinance. And in listening to Dr. Beige, who is the emergency room president or director for the hospital, and then we listened to Kim Hinkie the other night, who trains ICU nurses, and their expertise is absolutely on hand, and we appreciate it. But their ability to manage this virus has just been just absolutely a hit, and they know it. And so what we want to do is just make sure that we do all we can to provide support for them in any way possible.
So talk a little bit about this mask fine ordinance. Obviously, this is not very popular. People are pretty upset, pretty irritated. A lot of the businesses, the reaction that I'm getting from the businesses is that they feel like they're being targeted because they can potentially be fined for something that a customer is doing, and you're putting them in an enforcement mechanism, which isn't really where they want to be with their customers. So talk a little bit about the enforcement mechanism, the fines, where it came from, why everybody feels that this might be the right step in Elkhart.
Well, I think it's based on what side you look at it as to how people are really feeling about it. I'm getting obviously both, and the voices that you're hearing that are upset, they're valid and important as well. But this is just an extra layer that we believe was necessary. When I say we, I'm speaking of the health department, the county commissioners, and the city mayors are talking on a regular basis, trying to figure out how do we get to the light at the end of the tunnel. And the light at the end of the tunnel is really the vaccine, and we're hoping to get there soon, but it's still a long way off. And we believe the holiday numbers have put us in a place where we got to do as much as we can to let our public know how serious this virus is and is impacting our community. And the health order that went into effect on November 18th was one that mandated for all businesses, all entities, to have a COVID-19 response plan. And that including posting that service would be rendered or would not be rendered without face coverings, they had to implement and maintain sanitation measures, implement and maintain social distancing measures, implement staff and volunteer screening measures, ensure compliance by all of their staff, volunteers, and the public that utilize their services. So this checklist was something that all organizations are to provide. And that was done November 18th. And then following that, the county commissioners did what we call bootstrapping an ordinance that applied a fine structure that was pretty lenient. I mean, it's a warning. It's making sure that there was face coverings. And that's in all in unincorporated areas of Elkhart. And then the mayors we are attempting to bootstrap an ordinance to it inside of our municipality that was consistent with the fine structure that the county put in place. In Elkhart, we made the fines more lenient, and there are 3 or 2 warnings before there's any kind of fine, because we really want to.
Well, hold on. Let me just interrupt. Let me just interrupt. I don't mean to be stepping over you. I know that the connection's a little weird because I'm at home.
That's
but
okay.
Did anybody, when these conversations were coming up, did anybody present you any evidence that this is where we were seeing that there was a lack of enforcement of these mask mandates that was causing the numbers to go up? And did anybody present to you the evidence that the mask fines that have been implemented literally in every other state have not reduced the number of cases? So what is the point of doing something that has already been proven for months to not be effective if it's just going to cause angst in the community?
Casey, I'm not quite sure where you feel as though the substantive information that has come through has said that it hasn't been proven. What we were
well, I mean, you can this is all, you can look at all of the COVID dashboards for everybody that's implemented these fines. Every state that has implemented these fines has not had a reduction in cases. Every one.
Well, this particular piece is an additional layer from all of the education that we've seen from CDC, from the health organizations, and basically from not just CDC, but the FDA, any of the organizations that we reviewed have indicated from our health perspective and the healthcare professionals, the hospitals, all of them indicate that face coverings does help to reduce the spread.
That's not what the medical research that shows, though, Mayor. That's the problem. The real-world data doesn't show that, and the medical research doesn't show that. The only peer-reviewed studies done on masks and viruses show that they're ineffective. And here's another issue that I'm having, too, is you have top epidemiologists all across the world. Harvard, Stanford, Finland, Sweden, Russia. They're all saying the exact same thing, that we might actually have a problem where some of these cloth face coverings are actually spreading the virus because the governments aren't telling people to use them one time and then wash them anymore. So we're running into an issue here. The virus is airborne. You agree with that, correct?
Casey, I'm not going down that path. Only because
Why not?
I'm getting my. Let me
But
finish.
but here's the thing that I have to ask though, Mayor. Why aren't local officials going down the path of world-renowned epidemiologists who have been saying this from the very beginning? Why aren't you listening to those experts? Why are you only listening to local experts? There's only one study, Mayor. There's only one study that's been produced on COVID and masks specifically, and it says that there is little to no effect from them, and they may continue to spread the virus. And I've looked at every peer-reviewed mask study on virology going back to 2009. Without fail, 100% of them shows that face coverings do not prevent the spread of airborne viruses. They just don't. Not even in a sterilized hospital environment. But the issue isn't necessarily the face mask. It's why are you fining businesses and individuals for this?
What we want to do is go down the path of education, first of all. We want to make
so
sure
wouldn't
that,
the first step of that be to show what peer-reviewed study shows that the masks work? You mentioned the CDC earlier. The CDC has made it crystal clear that masks do not protect the wearer.
Our healthcare officials are saying just the opposite. And
so is the CDC and the WHO wrong?
I would have to rely on that, and I think what you're doing is cherry picking some information, Casey, because what we're getting from our healthcare officials is that masks absolutely are one of the mitigating procedures.
Mayor, I appreciate that position, but my cherry picking is the head of the CDC going, at no point did we ever say that cloth masks would protect the wearer. And my cherry picking information is peer-reviewed clinical research going back to 2009. There is zero peer-reviewed clinical research that shows that they work. So how is that cherry picking information?
You're wearing a mask to protect me. I'm wearing one to protect you. I don't know if I'm carrying it. You're absolutely right. I could be.
Okay, but asymptomatic people also rarely spread the virus, and that's what every study has shown on that.
We realize that community spread is an issue. The virus is being spread. It is real. And if you were swapping,
nobody's denying that it's not real, Mayor. That's the problem is that we seem to have a disconnect. For example, give me. Well, hold on a second. Give me one example. Mayor, give me one example of where masks have worked. One.
Casey,
I'm waiting.
It works every time. Every time someone is carrying the disease, somebody's carrying the virus asymptomatically, and they don't know it, and they're covering their face, and they're in proximity of someone that could spread it.
Only with droplets. Only with droplets, though, not with the airborne virus.
If they don't have it, there's an aerosol that comes out of your mouth with coughs and all that stuff. So with that said, if it's spread in that capacity, what we're trying to do is keep it at a minimum. And it doesn't have anything to do with the thought that we're trying to interfere with civil liberties or trying to do any of those things. What we're trying to do is just deal with as much as we can the spread that's occurring when you're within a 6 feet relationship without a mask.
Okay, so I'm still waiting for an example of one place on Earth that the mask mandates have worked.
All I know is that healthcare officials have said that it does,
but not all of them. That's the thing. Here's the point that I'm making, Mayor. And I don't mean to be disrespectful, but I've listened to this. I have listened to this now for 12 months. And what we have is we have top epidemiologists globally telling you the exact opposite of what you're saying local health officials are saying. My question is, why are we listening to some experts, not the others? What is the reasoning behind that? We've tried the mask mandates. They have not worked in a single location on Earth. Not at all. The mask fines have not worked to reduce numbers of cases anywhere in the United States. Why do we continue to pursue the same policies that we have already shown to fail? And why are we pursuing lockdowns in some places? I know that Elkhart hasn't gone this way yet, when even the WHO is saying lockdowns are a net negative and they don't work. Why are we pursuing these old policies that have already failed for a year? What's the point of that?
Casey, what we're trying to do, and our healthcare official has been receiving her information from the state health board, health department, as well as from other professionals who literally have spoke to just the opposite of what you're saying. And indeed, she is our healthcare official. With that said, the health order is what we are bootstrapping our ordinances to. And what we're trying to do, and what we think and believe, which is contrary to the information that you are suggesting,
which is the
exists.
peer-reviewed scientific information, for the record.
Well,
you're choosing to disagree. You're disagreeing with peer-reviewed scientific. Again, if you have a peer-reviewed scientific study that says the opposite of what I'm saying, I am willing to look at it.
Well, I think you should have this conversation with Dr. Mertz. You should have this conversation with our county officials. This is bipartisan. It has nothing to do with party. Especially in Elkhart County, we are working together in order to do it. What we're trying to do is just provide an additional layer of education and enforcement around how we are going to bring our numbers into a place where we can finally get out of the red. It's not just this ordinance. There are other areas that we are working on relative to our schools, relative to our places of employment. We really want to reduce the hospitalizations that are existing in Elkhart County. It is difficult. I think that there's information out there from multiple different sources, and our healthcare officials are choosing the science in their minds that are saying that masks help. Now, it's not just masks, but it's all the other mitigating procedures as well. Masks seem to be the elephant in the middle of the room that's providing the biggest blast. What we're doing is in our city, in our county, with our health department, what we're trying to do is just put an additional layer on. I completely understand the concern that in some respects people may believe that masks don't work, and maybe
which the science shows.
I think that I don't know why.
Again, I can give you peer-reviewed scientific studies going back to 2009 on that. You can't give me one that contradicts that, though, Mayor. And here's the thing: I'm not even opposed to the mask. I know that a lot of my listeners are, but my issue is, why has the government abandoned the basic principles at the beginning of this thing? Wear the mask one time, don't wear it again until you wash the thing. Now we got people running around wearing a mask that's 9 months old and dirty, getting upper respiratory infections, which, for the record, the NIH says is real. So if anybody says that's not true, that's a lie. You got people running around wearing these masks over and over again, not cleaning them, not sanitizing them. We're not pushing washing your hands. We're not pushing not touching your face. Everything has become about the mask, which from the very beginning, the top experts in the world said was the least effective tool in your tool chest to keep you from getting the virus. But now it's become the predominant tool, and cases have risen.
Well, it's too bad that folk are relying on the mask, and that's as I said earlier, we shouldn't just rely on the mask. I mean, there are.
I agree with that, but health officials nationally have pushed that.
Well, that's nationally. I'm pushing everything. I'm literally making sure that we're doing the isolating. We're maintaining the social distance as much as possible. I'm trying my best to make sure that we are informing folks on all fronts that that's what you need to do. And so I'm hopeful that no business will receive a fine. But I want to make sure that the public does understand that we as government officials, we as and our local healthcare officials and professionals are saying these mitigating measures can help. They're not the silver bullet. We don't have one. Community spread is just so broad, it's difficult. But if we are able to do anything to be there when the cavalry does come with the vaccine, we need to do all we can, and that's what we're trying to do.
All right, Mayor, I've got one final question, and I think that this is one that probably has to be sent back to your health officials. I have multiple people who work for Beacon Health. They have told me repeatedly that Beacon Health has told employees to come into work even if they've been exposed to COVID. Do you think maybe that is one of the bigger problems in the community that is being refused to be addressed?
I don't know exactly how they're managed their procedures relative to that. So it's difficult for me to speak to exactly what they've done internally. I know that the exposure also comes with symptoms as well, and I'm sure that they go through some real stringent screening processes. So I don't have any reason to believe that environment that our healthcare workers are working in is unsafe.
Okay.
I would hope that the people that would feel symptoms as I did would take care of themselves and ensure they're taking care of their families. But I don't necessarily believe that they would intentionally.
I certainly hope not.
Violate
I do certainly hope not.
procedure.
It might be something to ask them.
I mean, that's the hospital that we have. We have to figure out how we support them as much as possible, and that's what we're trying to do.
I got you. Well, maybe look at Bulgaria too. Bulgaria is not having a shortage of hospital officials. Has anybody mentioned to you why that might be? They're taking the hydroxychloroquine stack they started months ago. Nobody's getting sick who works for the hospitals. Might be something to consider.
I'm not a doctor. Can't go.
I understand.
There.
I understand you're not. I appreciate that.
I'm gonna start calling you Dr. Casey Hendrickson.
Hey,
can I call you
will take the title. If Jill Biden can have it, I can have it too. Darn it! All right, hey Mayor, I went really long. I appreciate it. You have no idea how much I respect the fact that you will come on this show. I really do, and I hope you will continue to do that. I actually went 2 segments with you without a commercial break. I'm getting yelled at. So
I came on with you earlier in my
you did
in my term, and I want everyone. I mean, everyone should understand that there are different sides of this, but please take the sides of precaution. Mask even if you believe the science that you believe, it cannot hurt. I would wash my mask. You're absolutely right. Keep it sanitized. Use masks that are disposable. Do what you need to. But swapping air is not good. So however we can prevent it, the better I think our community will be. So that's where I'm leaning toward.
All right. Mayor Roberson, I appreciate it. Thank you so much for the time.
Thank you. I appreciate it.
You take care. I'm way late. Joe, I apologize, but I wasn't going to take a commercial break on that one. We got more coming up, 95.3 MNC.
Michiana's news channel is everywhere. The top issues on Facebook and on Twitter at 95.3 MNC. Casey Hendrickson.
I'm going to be in so much trouble. I didn't take my first break in the hour at all. Good Lord.